Hello, nursing students. Welcome to Nursing Exam Preparation, your ultimate resource for excelling in nursing exams with confidence. In today's video, we'll guide you through 150 multiple-choice questions, MCQs, on myocardial infarction, heart attack, each carefully crafted to test your understanding and deepen your knowledge of this critical topic. Following each question, you'll find detailed explanations that not only clarify the correct answer, but also help you understand the reasoning behind it. Whether you're just starting your studies or revising for an exam, this video is packed with valuable content to sharpen your skills, enhance your critical thinking, and strengthen your grasp of key concepts related to myocardial infarction. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more invaluable resources. Be sure to hit the bell icon to stay updated on our latest videos, all designed to support your success. Once you've completed the video, let us know your score in the comments below. We'd love to hear how you did. Let's get started and work toward mastering myocardial infarction and achieving success in your nursing exams. 1. Which of the following is the most common cause of myocardial infarction, MI? A. Aortic stenosis. B. Coronary artery blockage. C. Pulmonary embolism. D. Pericarditis. Answer: B. Coronary artery blockage. Rationale: myocardial infarction is primarily caused by a blockage in one or more of the coronary arteries, which leads to ischemia and tissue damage. Aortic stenosis, pulmonary embolism, and pericarditis are not the leading causes of MI. 2. A 58-year-old male is experiencing chest pain radiating to his left arm. Which of the following signs would most likely confirm a diagnosis of myocardial infarction? A. Elevated troponin levels. B. Decreased blood pressure. C. Low hemoglobin levels. D. Increased white blood cell count. Answer: A. Elevated troponin levels. Rationale: elevated troponin levels are a highly specific marker for myocardial injury and are often elevated in MI. Decreased blood pressure can occur, but is not diagnostic. Low hemoglobin and increased white blood cells are not definitive indicators of MI. 3. Which of the following is a common risk factor for myocardial infarction? A. Hypothyroidism. B. Hyperlipidemia. C. Hyperkalemia. D. Anemia. Answer: B. Hyperlipidemia. Rationale: hyperlipidemia, high levels of cholesterol and triglycerides, is a major risk factor for atherosclerosis and myocardial infarction. Hypothyroidism, hyperkalemia, and anemia can contribute to other conditions, but are not direct risk factors for MI. 4. Which diagnostic test is commonly used to confirm the diagnosis of a myocardial infarction? A. Chest X-ray. B. Electrocardiogram, ECG. C. Complete blood count, CBC. D. Urinalysis. Answer: B. Electrocardiogram, ECG. Rationale: an ECG is a primary diagnostic tool for MI, as it can show characteristic changes like ST segment elevation or depression. Chest X-rays, CBC, and urinalysis are not used for diagnosing MI, though they may be used to rule out other conditions. 5. A patient with a recent myocardial infarction is prescribed aspirin. What is the primary purpose of this medication in the acute phase? A. To reduce inflammation. B. To reduce pain. C. To prevent platelet aggregation. D. To lower blood pressure. Answer: C. To prevent platelet aggregation. Rationale: aspirin helps reduce platelet aggregation, which is important in preventing further clot formation in the coronary arteries. It does not directly reduce pain, lower blood pressure, or reduce inflammation to the extent that it prevents additional cardiac events. 6. A patient who has suffered a myocardial infarction is at risk for developing which of the following complications? A. Asthma. B. Arrhythmias. C. Appendicitis. D. Gastroesophageal reflux disease. Answer: B. Arrhythmias. Rationale: arrhythmias, including ventricular fibrillation, are common complications of MI due to damage to the heart's conduction system. Asthma, appendicitis, and gastroesophageal reflux disease are not directly related to MI. 7. A nurse is educating a patient about lifestyle changes to reduce the risk of a future myocardial infarction. Which of the following recommendations is most important? A. Increase intake of saturated fats. B. Engage in regular physical activity. C. Limit water intake. D. Take vitamin C supplements. Answer: B. Engage in regular physical activity. Rationale: regular physical activity helps improve cardiovascular health, reduces cholesterol, and lowers blood pressure, all of which can reduce the risk of future MI. Increasing intake of saturated fats and taking vitamin C are not key factors in preventing MI. Limiting water intake is not necessary for MI prevention. 8. The nurse is monitoring a patient following a myocardial infarction who is receiving fibrinolytic therapy. Which of the following is a priority nursing assessment? A. Assess for signs of infection. B. Monitor for signs of bleeding. C. Monitor blood glucose levels. D. Assess for fever. Answer: B. Monitor for signs of bleeding. Rationale: fibrinolytic therapy is used to dissolve clots, but it also increases the risk of bleeding. Therefore, monitoring for signs of bleeding, e.g., bruising, hematomas, is a priority. Infection, blood glucose, and fever are important, but not the primary concerns in the immediate phase following fibrinolytic therapy. 9. A patient is diagnosed with a STEMI, ST elevation myocardial infarction. Which of the following would be the most likely initial intervention? A. Oral aspirin administration. B. Thrombolytic therapy. C. 4 antibiotics. D. Diuretic therapy. Answer: B. Thrombolytic therapy. Rationale: in STEMI, where there is a complete blockage of a coronary artery, thrombolytic therapy, e.g., TPA, is often used as the initial intervention to dissolve the clot. Oral aspirin helps prevent further clotting, but is secondary to thrombolytic therapy in acute cases. For antibiotics and diuretics are not appropriate first-line treatments for STEMI. 10. Which of the following is a primary cause of myocardial ischemia? A. Hypoxia. B. Atherosclerosis. C. Hyperkalemia. D. Anemia. Answer: B. Atherosclerosis. Rationale: atherosclerosis, the buildup of plaque in the coronary arteries, is the leading cause of myocardial ischemia, which leads to reduced blood flow and oxygen supply to the heart muscle. Hypoxia, hyperkalemia, and anemia can affect the heart, but are not primary causes of myocardial ischemia. 11. A nurse is assessing a patient who had a myocardial infarction 24 hours ago. The nurse should monitor for which of the following complications most likely to develop during this time frame? A. Pulmonary embolism. B. Heart failure. C. Pneumonia. D. Stroke. Answer: B. Heart failure. Rationale: the most common complication within the first 24 hours post-MI is heart failure due to the inability of the damaged heart to pump effectively. Pulmonary embolism, pneumonia, and stroke are potential complications, but are less likely to develop so early. 12. Which of the following laboratory markers is most commonly used to diagnose myocardial infarction? A. Blood urea nitrogen, BUN. B. Creatine kinase, CKMB. C. White blood cell count. D. Serum glucose. Answer: B. Creatine kinase, CKMB. Rationale: CKMB is a cardiac enzyme that rises significantly following myocardial injury, making it a key diagnostic marker for myocardial infarction. BUN, white blood cells, and serum glucose may be elevated in some conditions, but are not specific to MI. 13. Which of the following is a contraindication to fibrinolytic therapy in a patient with a myocardial infarction? A. Severe hypertension. B. Age older than 75 years. C. History of asthma. D. History of deep vein thrombosis. Answer: A. Severe hypertension. Rationale: severe hypertension is a contraindication for fibrinolytic therapy because it increases the risk of bleeding complications. Age, asthma, and a history of deep vein thrombosis are not absolute contraindications, although they should still be evaluated carefully. 14. What is the role of nitroglycerin in the management of myocardial infarction? A. It reduces myocardial oxygen demand. B. It increases blood pressure to improve coronary perfusion. C. It prevents clot formation in the coronary arteries. D. It accelerates the breakdown of clots. Answer: A. It reduces myocardial oxygen demand. Rationale: nitroglycerin is a vasodilator that reduces the heart's workload by lowering myocardial oxygen demand. It does not directly affect clot formation or breakdown. While it can lower blood pressure, its primary action is vasodilation to improve oxygen delivery to the heart. 15. A patient is receiving morphine for pain relief following a myocardial infarction. Which of the following is the primary effect of morphine in this context? A. Reducing myocardial oxygen consumption. B. Increasing blood pressure. C. Preventing arrhythmias. D. Dissolving clots in the coronary arteries. Answer: A. Reducing myocardial oxygen consumption. Rationale: morphine helps relieve pain, which reduces the stress on the heart and lowers myocardial oxygen demand. It does not directly prevent arrhythmias, increase blood pressure, or dissolve clots. 16. Which of the following is an essential intervention for a patient who is suspected of having a myocardial infarction? A. Immediate physical therapy. B. Administering oxygen. C. Restricting all oral intake. D. Administering diuretics. Answer: B. Administering oxygen. Rationale: administering oxygen is a critical intervention for MI to help increase oxygen delivery to the ischemic myocardium. Physical therapy, restricting oral intake, and administering diuretics are not urgent interventions in the acute phase. 17. Which of the following arrhythmias is most commonly associated with a myocardial infarction? A. Atrial fibrillation. B. Ventricular tachycardia. C. Sinus bradycardia. D. Premature ventricular contractions, PVCs. Answer: B. Ventricular tachycardia. Rationale: ventricular tachycardia is a life-threatening arrhythmia commonly seen in the acute phase of myocardial infarction, especially after significant damage to the myocardium. Atrial fibrillation, sinus bradycardia, and PVCs can occur but are less directly linked to acute MI. 18. A nurse is caring for a patient who is recovering from a myocardial infarction. The nurse should prioritize which of the following as part of discharge planning? A. Educating the patient on smoking cessation. B. Providing a prescription for long-term steroid therapy. C. Scheduling follow-up with a gastroenterologist. D. Discussing weight loss surgery options. Answer: A. Educating the patient on smoking cessation. Rationale: smoking cessation is crucial to reduce the risk of further cardiovascular events. Steroid therapy, gastroenterology follow-up, and weight loss surgery are not primary concerns in the immediate post-MI recovery phase. 19. Which of the following medications is commonly used to prevent platelet aggregation after a myocardial infarction? A. Heparin. B. Warfarin. C. Clopidogrel. D. Lisinopril. Answer: C. Clopidogrel. Rationale: clopidogrel is an antiplatelet medication that is commonly used after MI to prevent further clot formation. Heparin and warfarin are anticoagulants, while lisinopril is an ACE inhibitor used to reduce blood pressure and protect the heart after an MI. 20. What is the primary function of the thrombolytic drugs used in the treatment of myocardial infarction? A. To reduce myocardial oxygen demand. B. To dissolve clots blocking the coronary arteries. C. To prevent arrhythmias. D. To relieve chest pain. Answer: B. To dissolve clots blocking the coronary arteries. Rationale: thrombolytic drugs are used to dissolve clots that are blocking the coronary arteries, which is critical in restoring blood flow during a myocardial infarction. They do not directly affect oxygen demand, arrhythmias, or pain relief, though they can help improve overall symptoms by restoring circulation. 21. A 65-year-old male patient presents with chest pain, diaphoresis, and nausea. He is diagnosed with a myocardial infarction. What is the first intervention to be initiated? A. Administer oxygen. B. Give morphine. C. Administer aspirin. D. Administer fibrinolytics. Answer: A. Administer oxygen. Rationale: Administering oxygen is the first intervention for suspected myocardial infarction to improve oxygen delivery to the heart muscle. Morphine and aspirin are important, but come after oxygen administration. Fibrinolytics are used later, if indicated. 22. What is the primary purpose of administering beta blockers to a patient after a myocardial infarction? A. To dissolve the clot. B. To reduce the risk of arrhythmias. C. To reduce blood pressure. D. To decrease myocardial oxygen demand. Answer. D. To decrease myocardial oxygen demand. Rationale. Beta blockers reduce myocardial oxygen demand by slowing the heart rate and decreasing contractility, which helps prevent further ischemia. They can also reduce the risk of arrhythmias and lower blood pressure, but are primarily used to decrease the workload on the heart. 23. The nurse is educating a patient about lifestyle modifications to prevent a future myocardial infarction. Which of the following should be included in the teaching plan? A. Increase red meat intake. B. Limit physical activity. C. Stop smoking. D. Decrease fiber intake. Answer. C. Stop smoking. Rationale. Smoking is a major risk factor for coronary artery disease and myocardial infarction. Encouraging smoking cessation is crucial. Increasing red meat intake and decreasing fiber intake are not advisable, and limiting physical activity may worsen cardiovascular health. 24. A patient with a myocardial infarction is prescribed ACE inhibitors. What is the primary benefit of ACE inhibitors in this context? A. To prevent platelet aggregation. B. To decrease the risk of arrhythmias. C. To prevent heart failure and improve survival. D. To reduce pain and discomfort. Answer. C. To prevent heart failure and improve survival. Rationale. ACE inhibitors help reduce the strain on the heart, prevent heart failure, and improve survival rates after a myocardial infarction. They do not directly affect platelet aggregation, arrhythmias, or pain relief. 25. Which of the following ECG changes is most indicative of a myocardial infarction? A. T-wave inversion. B. ST segment elevation. C. PR interval prolongation. D. QRS complex widening. Answer. B. ST segment elevation. Rationale. ST segment elevation on the ECG is the hallmark sign of a STEMI, indicating acute myocardial injury. T-wave inversion can also occur, but is less specific. PR interval prolongation and QRS widening are not characteristic of MI. 26. A patient who is recovering from a myocardial infarction asks when he can resume normal physical activity. The nurse's response should be based on which of the following? A. Physical activity should be avoided for 2 weeks. B. Normal activity can be resumed once the patient is pain-free. C. Physical activity should be resumed immediately after discharge. D. Physical activity should be resumed gradually as recommended by the healthcare provider. Answer. D. Physical activity should be resumed gradually as recommended by the healthcare provider. Rationale. After a myocardial infarction, physical activity should be resumed gradually with a healthcare provider's guidance to avoid stressing the heart. Resuming activity immediately or after only 2 weeks without guidance can be harmful. 27. Which of the following medications is typically administered to prevent the formation of a clot in a patient with a myocardial infarction? A. Metoprolol. B. Warfarin. C. Heparin. D. Digoxin. Answer. C. Heparin. Rationale. Heparin is commonly used in the acute phase of myocardial infarction to prevent further clot formation. Metoprolol is a beta blocker, warfarin is an anticoagulant used long-term, and digoxin is used for heart failure but not for preventing clot formation in MI. 28. Which of the following is a sign of myocardial infarction in women that may be different from the classic signs in men? A. Severe chest pain radiating to the left arm. B. Nausea and vomiting. C. Diaphoresis. D. Sharp, localized chest pain. Answer. B. Nausea and vomiting. Rationale. Women are more likely to experience atypical symptoms such as nausea, vomiting, and fatigue, rather than the classic chest pain radiating to the left arm. Diaphoresis and chest pain can also be present but are not exclusive to men. 29. Which of the following is the most appropriate nursing action if a patient is experiencing chest pain and is suspected of having a myocardial infarction? A. Encourage the patient to take deep breaths. B. Administer nitroglycerin as ordered. C. Offer the patient water to drink. D. Encourage the patient to walk around to relieve the pain. Answer. B. Administer nitroglycerin as ordered. Rationale. Nitroglycerin is commonly administered to relieve chest pain by dilating coronary arteries, improving blood flow to the heart. Deep breathing, offering water, or encouraging walking is not appropriate for a patient with suspected MI. 30. What is the primary purpose of using thrombolytics in the treatment of myocardial infarction? A. To lower blood pressure. B. To break up clots blocking coronary arteries. C. To prevent arrhythmias. D. To reduce pain. Answer. B. To break up clots blocking coronary arteries. Rationale. Thrombolytics are used to dissolve clots in the coronary arteries, which restores blood flow and minimizes heart damage. They do not directly lower blood pressure, prevent arrhythmias, or reduce pain, although they may indirectly help by improving perfusion. 31. Which of the following is a common complication that can develop after a myocardial infarction? A. Peptic ulcer disease. B. Acute kidney injury. C. Acute respiratory distress syndrome, ARDS. D. Pulmonary edema. Answer. D. Pulmonary edema. Rationale. Pulmonary edema is a common complication of myocardial infarction, especially if heart failure develops due to the heart's inability to pump blood effectively. Peptic ulcer disease, acute kidney injury, and ARDS are not as directly related to MI. 32. What is the role of morphine in the management of acute myocardial infarction? A. To increase heart rate. B. To relieve pain and reduce myocardial oxygen demand. C. To prevent blood clots. D. To lower blood pressure. Answer. B. To relieve pain and reduce myocardial oxygen demand. Rationale. Morphine helps manage pain and anxiety in the acute phase of myocardial infarction, and it also reduces myocardial oxygen demand by decreasing stress on the heart. It does not increase heart rate or prevent clots. 33. In the acute phase of a myocardial infarction, which of the following is most important to monitor? A. Serum calcium levels. B. Electrolyte balance. C. Blood pressure and heart rhythm. D. Serum protein levels. Answer. C. Blood pressure and heart rhythm. Rationale. Monitoring blood pressure and heart rhythm is crucial in the acute phase of MI, as these can provide information on the heart's ability to pump effectively and any arrhythmias. Electrolyte imbalances may develop but are secondary to heart function. 34. A patient is being treated for a myocardial infarction and is given an intravenous infusion of heparin. What is the primary action of heparin? A. To dissolve the clot. B. To increase platelet aggregation. C. To prevent the formation of new clots. D. To lower blood pressure. Answer. C. To prevent the formation of new clots. Rationale. Heparin is an anticoagulant that helps prevent the formation of new clots but does not directly dissolve existing clots. It works by inhibiting clotting factors. 35. Which of the following signs and symptoms is most commonly associated with a myocardial infarction in the elderly? A. Sudden severe chest pain. B. Shortness of breath and confusion. C. Nausea and vomiting. D. Radiating pain down the left arm. Answer. B. Shortness of breath and confusion. Rationale. In elderly patients, the signs of myocardial infarction can be more subtle, with shortness of breath and confusion being more common than classic chest pain or radiating pain. 36. What is the first-line medication used to manage pain in patients with a myocardial infarction? A. Acetaminophen. B. Ibuprofen.
C. Morphine.
D. Aspirin. Answer. C. Morphine. Rationale. Morphine is used as the first-line pain management for myocardial infarction because it not only provides pain relief, but also helps reduce myocardial oxygen demand. Aspirin is used to reduce clot formation, but it is not the first choice for pain relief. 37. A nurse is preparing to administer aspirin to a patient with a myocardial infarction. What is the rationale for using aspirin in this patient? A. To reduce inflammation. B. To prevent platelet aggregation. C. To treat bacterial infection. D. To reduce fever. Answer: B. To prevent platelet aggregation. Rationale: aspirin inhibits platelet aggregation, helping prevent further clot formation in the coronary arteries. It does not treat infections, reduce fever, or primarily reduce inflammation in the context of MI. 38. A patient is admitted with a myocardial infarction and is prescribed aspirin. What is the primary effect of aspirin in this patient? A. To lower blood pressure. B. To prevent the formation of blood clots. C. To relieve chest pain. D. To increase heart rate. Answer: B. To prevent the formation of blood clots. Rationale: aspirin works as an antiplatelet agent, preventing blood clot formation, which is crucial to avoid further blockages in the coronary arteries. It does not lower blood pressure, relieve chest pain directly, or increase heart rate. 39. A patient recovering from a myocardial infarction is prescribed a statin. What is the primary purpose of statins in the management of MI? A. To increase heart rate. B. To lower blood pressure. C. To lower cholesterol levels. D. To reduce inflammation. Answer: C. To lower cholesterol levels. Rationale: statins are primarily used to lower cholesterol levels and reduce the risk of further atherosclerotic plaques, which can lead to another myocardial infarction. They do not directly affect heart rate or blood pressure. 40. The nurse is educating a patient on signs of a recurrent myocardial infarction. Which of the following should the nurse emphasize as a common symptom? A. Severe headaches. B. Chest pain or discomfort. C. Nausea and vomiting. D. Difficulty swallowing. Answer: B. Chest pain or discomfort. Rationale: chest pain or discomfort is the most common symptom of a recurrent myocardial infarction. While nausea and vomiting can occur, they are more common in women and are not as definitive. Severe headaches and difficulty swallowing are not typical signs of MI. 41. Which of the following laboratory tests is most sensitive and specific for diagnosing a myocardial infarction? A. Hemoglobin A1C. B. Troponin levels. C. Blood urea nitrogen (BUN). D. Serum potassium levels. Answer: B. Troponin levels. Rationale: troponin is a highly sensitive and specific biomarker for myocardial injury, making it the gold standard for diagnosing myocardial infarction. Hemoglobin A1C, BUN, and potassium levels are not specific to MI. 42. A nurse is assessing a patient following a myocardial infarction. Which of the following would be most concerning? A. Heart rate of 90 bpm. B. Oxygen saturation of 94%. C. Blood pressure of 150/90 mmHg. D. New onset of irregular heart rhythm. Answer: D. New onset of irregular heart rhythm. Rationale: a new irregular heart rhythm, such as atrial fibrillation or ventricular arrhythmias, is a concerning complication following a myocardial infarction, as it may lead to hemodynamic instability or sudden cardiac arrest. The other findings, although they may require monitoring, are less immediately concerning. 43. Which of the following findings would be most expected in a patient with a myocardial infarction? A. Decreased respiratory rate. B. Increased respiratory rate. C. Increased heart rate. D. Decreased heart rate. Answer: C. Increased heart rate. Rationale: an increased heart rate, tachycardia, is a common response to myocardial infarction as the body attempts to compensate for the decreased oxygen supply to the heart. Increased respiratory rate is also common, but increased heart rate is more directly related to MI. 44. A patient is diagnosed with a non-ST elevation myocardial infarction (STEMI). Which of the following interventions is typically recommended? A. Immediate thrombolytic therapy. B. Percutaneous coronary intervention (PCI). C. Fibrinolytics. D. Immediate coronary artery bypass surgery. Answer: B. Percutaneous coronary intervention, PCI. Rationale: NCLEX usually requires PCI, which is a procedure to open up blocked arteries. Thrombolytic therapy and fibrinolytics are not typically used for NCLEX, as this is not associated with complete artery blockage like STEMI. Coronary artery bypass surgery is generally reserved for more severe cases. 45. Which of the following is a potential complication of a myocardial infarction? A. Hypoglycemia. B. Cardiac tamponade. C. Osteoporosis. D. Acute renal failure. Answer: B. Cardiac tamponade. Rationale: cardiac tamponade can occur as a complication of myocardial infarction due to fluid accumulation around the heart, which can impair its ability to pump blood effectively. Hypoglycemia, osteoporosis, and acute renal failure are not common complications of MI. 46. Which of the following is the most important aspect of managing a patient immediately following a myocardial infarction? A. Preventing arrhythmias. B. Promoting ambulation. C. Enhancing mobility. D. Administering sedatives. Answer: A. Preventing arrhythmias. Rationale: preventing arrhythmias, especially life-threatening ones like ventricular fibrillation, is critical in the immediate post-MI period. Promoting ambulation and mobility are important later in recovery, but the primary focus is on stabilizing the heart's rhythm. 47. Which of the following is the most appropriate intervention for a patient with a myocardial infarction who is experiencing acute pain? A. Administering oral acetaminophen. B. Administering morphine as prescribed. C. Encouraging deep breathing exercises. D. Giving the patient water to drink. Answer: B. Administering morphine as prescribed. Rationale: morphine is a potent analgesic that is commonly used to manage pain and reduce myocardial oxygen demand in patients with acute myocardial infarction. Acetaminophen, deep breathing, and drinking water are not effective for managing acute pain associated with MI. 48. A nurse is caring for a patient who is receiving thrombolytic therapy for a myocardial infarction. What is a priority nursing action? A. Monitor the patient for signs of bleeding. B. Encourage the patient to drink more fluids. C. Increase the patient's physical activity. D. Administer oxygen if the patient becomes hypoxic. Answer: A. Monitor the patient for signs of bleeding. Rationale: thrombolytic therapy increases the risk of bleeding, so it is crucial to monitor for signs of bleeding, e.g., bruising, hematomas, hematuria. The other actions are important but not as immediate as monitoring for bleeding. 49. What is the recommended nursing intervention for a patient who is post-myocardial infarction and has a blood pressure of 90/60 millimeter of mercury? A. Administer fluids as ordered. B. Increase the rate of intravenous morphine. C. Give the patient a sedative. D. Encourage the patient to sit up. Answer: A. Administer fluids as ordered. Rationale: hypotension can occur after MI, and fluid resuscitation may be necessary to stabilize blood pressure. Administering morphine or sedatives may exacerbate hypotension, and sitting up could further decrease blood pressure. 50. A nurse is preparing to administer a beta blocker to a patient post-myocardial infarction. Which of the following is the primary effect of beta blockers in this patient? A. Increasing the heart rate. B. Decreasing blood pressure. C. Preventing blood clot formation. D. Dilating blood vessels. Answer: B. Decreasing blood pressure. Rationale: beta blockers decrease blood pressure and heart rate, helping to reduce myocardial oxygen demand and prevent further damage to the heart. They do not increase heart rate or directly prevent blood clot formation. 51. A patient who suffered a myocardial infarction is being started on an ACE inhibitor. What is the primary benefit of this medication? A. To increase heart rate. B. To reduce myocardial oxygen demand. C. To improve cardiac output and prevent heart failure. D. To dissolve blood clots. Answer: C. To improve cardiac output and prevent heart failure. Rationale: ACE inhibitors help prevent heart failure and improve cardiac output by reducing the workload on the heart. They do not affect heart rate or directly dissolve blood clots. 52. The nurse is monitoring a patient with a myocardial infarction for potential complications. Which of the following is most likely to occur in the first 24 hours after an MI? A. Pulmonary embolism. B. Severe arrhythmias. C. Chronic kidney disease. D. Gallbladder disease. Answer: B. Severe arrhythmias. Rationale: severe arrhythmias, including ventricular fibrillation, are most likely to occur in the first 24 hours following a myocardial infarction, especially in patients with significant myocardial damage. Pulmonary embolism and kidney disease are less likely to develop so quickly. 53. A patient with a myocardial infarction has been prescribed clopidogrel. What is the primary reason for prescribing this medication? A. To lower cholesterol. B. To prevent further clot formation. C. To control blood sugar. D. To reduce heart rate. Answer: B. To prevent further clot formation. Rationale: clopidogrel is an antiplatelet medication used to prevent further clot formation after a myocardial infarction. It does not directly affect cholesterol levels, blood sugar, or heart rate. 54. Which of the following findings would be considered a complication of myocardial infarction that requires immediate intervention? A. Bradycardia. B. Chest pain that radiates to the left arm. C. Hypotension and decreased urinary output. D. Dyspnea on exertion. Answer: C. Hypotension and decreased urinary output. Rationale: hypotension and decreased urinary output are signs of potential cardiogenic shock or heart failure, which requires immediate intervention. Bradycardia, chest pain, and dyspnea can be signs of MI, but these are not as immediately life-threatening as hypotension and decreased urinary output. 55. What is the purpose of using a thrombolytic agent in the treatment of a myocardial infarction? A. To relieve pain. B. To dissolve the clot causing the blockage. C. To prevent arrhythmias. D. To reduce heart failure. Answer: B. To dissolve the clot causing the blockage. Rationale: thrombolytic agents are used to dissolve the blood clot causing the blockage in the coronary artery, which restores blood flow to the heart muscle. They do not directly relieve pain, prevent arrhythmias, or reduce heart failure. 56. A patient who has recently had a myocardial infarction is receiving a heparin infusion. What is the most important nursing action while the patient is receiving this medication? A. Monitor for signs of bleeding. B. Administer vitamin K as needed. C. Monitor heart rate for tachycardia. D. Restrict fluids to prevent overload. Answer: A. Monitor for signs of bleeding. Rationale: heparin is an anticoagulant, which increases the risk of bleeding. It is essential to monitor for signs of bleeding during its administration. Vitamin K is used to reverse warfarin, not heparin. Tachycardia and fluid restriction are not directly related to heparin therapy. 57. Which of the following is the most common cause of myocardial infarction? A. Atherosclerosis. B. Hypertension. C. Cardiomyopathy. D. Pericarditis. Answer: A. Atherosclerosis. Rationale: atherosclerosis, the buildup of plaque in the coronary arteries, is the most common cause of myocardial infarction. Hypertension can contribute but is not the direct cause, and cardiomyopathy and pericarditis are not primary causes of MI. 58. What is the primary purpose of using nitrates in a patient with myocardial infarction? A. To relieve pain and reduce preload. B. To increase heart rate. C. To increase blood pressure. D. To improve kidney function. Answer: A. To relieve pain and reduce preload. Rationale: nitrates work by dilating blood vessels, which reduces the heart's workload and preload, helping relieve chest pain associated with myocardial infarction. They do not increase heart rate or blood pressure. 59. Which of the following is the most likely complication in the first 48 hours following a myocardial infarction? A. Stroke. B. Cardiogenic shock. C. Pulmonary embolism. D. Renal failure. Answer: B. Cardiogenic shock. Rationale: cardiogenic shock, due to the heart's inability to pump blood effectively after a myocardial infarction, is a serious and common complication in the first 48 hours. Stroke, pulmonary embolism, and renal failure are less likely in the immediate aftermath. 60. A patient with a myocardial infarction is receiving thrombolytic therapy. What is the most important nursing intervention during this treatment? A. Monitor for signs of bleeding. B. Monitor blood pressure for hypotension. C. Monitor for hyperkalemia. D. Administer oxygen. Answer: A. Monitor for signs of bleeding. Rationale: thrombolytic therapy increases the risk of bleeding, so the most important intervention is to monitor for signs of bleeding, e.g., bruising, blood in urine. Monitoring blood pressure and oxygen is also important, but bleeding is the highest priority. 61. A 60-year-old male patient with a history of smoking and hypertension presents with chest pain. The ECG shows ST segment elevation. What is the most likely diagnosis? A. Stable angina. B. Myocardial infarction. C. Unstable angina. D. Pericarditis. Answer: B. Myocardial infarction. Rationale: ST segment elevation on the ECG is a classic sign of STEMI, a type of myocardial infarction. Stable angina typically does not present with ST segment elevation, and pericarditis is not associated with this finding. 62. A patient presents with chest pain, shortness of breath, and nausea. Which blood test is most likely to confirm a myocardial infarction? A. Creatinine kinase (CK) levels. B. Troponin levels. C. Hemoglobin levels. D. Sodium levels. Answer: B. Troponin levels. Rationale: troponin is the most specific and sensitive biomarker for myocardial injury, making it the best test for confirming a myocardial infarction. CK levels may also rise, but troponin is more reliable. 63. What is the first-line treatment for a patient with acute myocardial infarction and chest pain? A. Morphine. B. Fibrinolytics. C. Oxygen therapy. D. Aspirin. Answer: D. Aspirin. Rationale: aspirin is administered immediately to reduce platelet aggregation and prevent further clot formation. Morphine and fibrinolytics may follow, but aspirin is the first-line treatment. Oxygen therapy is also given, but is secondary to aspirin. 64. A patient has a myocardial infarction and is prescribed a calcium channel blocker. What is the primary effect of this medication? A. Increase myocardial oxygen consumption. B. Increase heart rate. C. Dilate coronary arteries and reduce blood pressure. D. Increase blood clotting. Answer: C. Dilate coronary arteries and reduce blood pressure. Rationale: calcium channel blockers dilate coronary arteries, reduce blood pressure, and decrease myocardial oxygen demand. They do not increase heart rate or promote blood clotting. 65. A patient recovering from a myocardial infarction is started on a low-sodium diet. What is the primary reason for this dietary change? A. To prevent fluid retention and manage blood pressure. B. To decrease cholesterol levels. C. To improve digestion and prevent constipation. D. To increase urinary output. Answer: A. To prevent fluid retention and manage blood pressure. Rationale: a low-sodium diet helps prevent fluid retention and control blood pressure, which is crucial for heart function after a myocardial infarction. The other options are not primary reasons for restricting sodium. 66. What is the most important reason to administer aspirin to a patient immediately after a myocardial infarction? A. To reduce inflammation. B. To prevent the formation of additional blood clots. C. To relieve pain. D. To increase heart rate. Answer: B. To prevent the formation of additional blood clots. Rationale: aspirin inhibits platelet aggregation, preventing further clot formation and reducing the risk of additional blockages in the coronary arteries. It does not primarily reduce inflammation, relieve pain, or increase heart rate. 67. The nurse is educating a patient about the risks of a myocardial infarction. Which of the following is the most modifiable risk factor? A. Age. B. Family history. C. Smoking. D. Gender. Answer: C. Smoking. Rationale: smoking is a modifiable risk factor for myocardial infarction. Age, family history, and gender are non-modifiable. Smoking cessation is crucial for reducing the risk of heart disease. 68. A patient diagnosed with a myocardial infarction is being started on an anticoagulant. What is the most likely reason for this medication? A. To prevent arrhythmias. B. To prevent further clot formation. C. To decrease myocardial oxygen demand. D. To reduce cholesterol levels. Answer: B. To prevent further clot formation. Rationale: anticoagulants prevent the formation of additional blood clots in the coronary arteries, which can reduce the risk of further ischemia or infarction. They do not directly prevent arrhythmias or reduce cholesterol. 69. Which of the following is a classic symptom of myocardial infarction in men? A. Chest pain radiating to the back. B. Chest pain radiating to the left arm. C. Severe headache. D. Sudden vision changes. Answer: B. Chest pain radiating to the left arm. Rationale: chest pain that radiates to the left arm is a classic symptom of myocardial infarction in men. Although other symptoms may be present, this is one of the most recognized signs. 70. Which of the following is the priority nursing action for a patient with a myocardial infarction experiencing severe chest pain? A. Administer pain medication. B. Position the patient in a high Fowler's position. C. Give the patient fluids to drink. D. Monitor the patient's vital signs every 30 minutes. Answer: A. Administer pain medication. Rationale: the priority action is to relieve the patient's pain, often using nitroglycerin or morphine. Positioning, fluids, and monitoring are important but secondary to pain relief in this acute setting. 71. A patient with a history of myocardial infarction asks about the role of exercise in their recovery. What should the nurse advise? A. Avoid all physical activity for at least 6 months. B. Gradually increase physical activity under medical supervision. C. Exercise only if cleared by a cardiologist for intense activity. D. Avoid exercise until they are completely symptom-free. Answer: B. Gradually increase physical activity under medical supervision. Rationale: gradually increasing physical activity under the supervision of a healthcare provider is crucial for recovery following myocardial infarction. Prolonged inactivity can worsen cardiovascular health. 72. What is the primary purpose of administering fibrinolytics in the early treatment of myocardial infarction? A. To relieve pain. B. To dissolve the clot obstructing the coronary artery. C. To decrease blood pressure. D. To treat arrhythmias. Answer: B. To dissolve the clot obstructing the coronary artery. Rationale: fibrinolytics are used to break down the clot blocking the coronary artery, which restores blood flow to the heart muscle. They do not relieve pain directly, lower blood pressure, or treat arrhythmias. 73. A nurse is caring for a patient post-myocardial infarction. Which of the following is most important to monitor in the first 24 hours? A. Oxygen saturation levels. B. Electrolyte imbalances. C. Cardiac rhythm. D. Renal function. Answer: C. Cardiac rhythm. Rationale: monitoring cardiac rhythm is crucial in the first 24 hours after an MI to detect arrhythmias, which are common and can be life-threatening. Oxygen levels, electrolytes, and renal function are important, but less critical immediately post-MI. 74. Which of the following is a risk factor for myocardial infarction that can be controlled with lifestyle changes? A. Gender. B. Age. C. Physical inactivity. D. Family history. Answer: C. Physical inactivity. Rationale: physical inactivity is a modifiable risk factor for myocardial infarction. Gender, age, and family history are non-modifiable. Increasing physical activity can reduce the risk of MI. 75. A patient with a myocardial infarction is receiving morphine for pain management. What is an additional benefit of morphine in this patient? A. Reduces myocardial oxygen demand. B. Increases heart rate. C. Increases blood pressure. D. Improves renal function. Answer. A. Reduces myocardial oxygen demand. Rationale. Morphine helps reduce myocardial oxygen demand by alleviating pain and anxiety. It does not increase heart rate, blood pressure, or improve renal function directly. 76. Which of the following is the most common ECG finding in a patient experiencing a myocardial infarction? A. ST segment elevation. B. Sinus bradycardia. C. Premature ventricular contractions. D. U-wave inversion. Answer. A. ST segment elevation. Rationale. ST segment elevation is a classic ECG finding in STEMI, indicating an ongoing myocardial infarction. Sinus bradycardia, PVCs, and U-wave inversion may occur, but are not as characteristic of MI. 77. A patient has a myocardial infarction and is on a heparin infusion. What lab test is essential to monitor during this therapy? A. Potassium levels. B. Activated partial thromboplastin time, APTT. C. Hemoglobin levels. D. Prothrombin time, PT. Answer. B. Activated partial thromboplastin time, APTT. Rationale. Heparin affects the clotting cascade, so monitoring APTT is essential to ensure the patient is within the therapeutic range to prevent excessive bleeding. PT and potassium levels are not as specific to heparin therapy. 78. A patient with a myocardial infarction is prescribed beta blockers. Which of the following is the primary effect of beta blockers in this patient? A. To increase heart rate. B. To reduce myocardial oxygen demand. C. To improve circulation to the brain. D. To reduce cholesterol levels. Answer. B. To reduce myocardial oxygen demand. Rationale. Beta blockers reduce myocardial oxygen demand by lowering heart rate and blood pressure, which helps prevent further damage to the heart. They do not increase heart rate or improve brain circulation directly. 79. Which of the following is the most important long-term goal for a patient recovering from a myocardial infarction? A. Increase physical activity. B. Control blood pressure and cholesterol levels. C. Eliminate all stress. D. Decrease oxygen consumption. Answer. B. Control blood pressure and cholesterol levels. Rationale. Controlling blood pressure and cholesterol levels is key to preventing further heart attacks and promoting long-term recovery. Increasing physical activity and stress reduction are important, but blood pressure and cholesterol control are the priorities. 80. A patient with myocardial infarction is placed on bed rest. What is the primary reason for restricting physical activity during the acute phase? A. To reduce the risk of bleeding. B. To prevent further strain on the heart. C. To manage pain. D. To reduce the risk of infection. Answer. B. To prevent further strain on the heart. Rationale. Bed rest helps to reduce the workload on the heart, minimizing the risk of further ischemia or damage to the heart muscle. It is not primarily to prevent bleeding, manage pain, or reduce infection. 81. What is the primary goal of thrombolytic therapy in the treatment of a myocardial infarction? A. To decrease pain. B. To dissolve the clot causing the coronary artery blockage. C. To reduce blood pressure. D. To improve heart rate. Answer. B. To dissolve the clot causing the coronary artery blockage. Rationale. Thrombolytic therapy aims to break down the blood clot obstructing the coronary artery and restore blood flow to the heart muscle. It does not directly reduce pain, blood pressure, or heart rate. 82. What is the earliest biomarker to rise in the blood following a myocardial infarction? A. Troponin. B. Myoglobin. C. Creatine kinase, CK. D. Lactate dehydrogenase, LDH. Answer. B. Myoglobin. Rationale. Myoglobin is the earliest biomarker to rise after a myocardial infarction, though it is less specific than troponin. Troponin is the most specific and sensitive biomarker for myocardial injury. 83. What is a common complication of myocardial infarction that can result in sudden death? A. Pulmonary embolism. B. Acute kidney failure. C. Ventricular fibrillation. D. Deep vein thrombosis. Answer: C. Ventricular fibrillation. Rationale: ventricular fibrillation is a life-threatening arrhythmia that can occur after a myocardial infarction and may lead to sudden cardiac arrest. The other options are less likely to result in sudden death immediately after MI. 84. Which medication is often prescribed to a patient after a myocardial infarction to reduce the risk of future clots? A. Digoxin. B. Aspirin. C. Furosemide. D. Atorvastatin. Answer: B. Aspirin. Rationale: aspirin is an antiplatelet medication that reduces the risk of blood clot formation in the arteries and is commonly prescribed after a myocardial infarction to prevent future clots. Digoxin, furosemide, and atorvastatin have other uses. 85. Which of the following symptoms is most commonly associated with a myocardial infarction in women? A. Severe chest pain. B. Left arm pain. C. Nausea and shortness of breath. D. Sudden collapse. Answer: C. Nausea and shortness of breath. Rationale: women may experience atypical symptoms such as nausea, shortness of breath, and fatigue, rather than classic chest pain and arm pain. Severe chest pain is more commonly reported in men. 86. A patient who has had a myocardial infarction is being discharged. Which statement by the patient indicates the need for further teaching? A. I should take my aspirin as prescribed. B. I can return to my normal routine immediately. C. I will stop smoking to reduce my heart attack risk. D. I need to monitor my blood pressure regularly. Answer: B. I can return to my normal routine immediately. Rationale: after a myocardial infarction, it is essential for the patient to gradually resume physical activity, not return to their normal routine immediately. The other statements indicate an understanding of post-MI care. 87. A patient with a myocardial infarction is started on ACE inhibitors. What is the primary benefit of this medication in MI recovery? A. Decreases heart rate. B. Reduces blood pressure and prevents heart failure. C. Prevents blood clot formation. D. Increases oxygen delivery to the heart. Answer: B. Reduces blood pressure and prevents heart failure. Rationale: ACE inhibitors help reduce blood pressure and prevent the progression of heart failure, which is a common complication of myocardial infarction. They do not directly decrease heart rate, prevent clot formation, or increase oxygen delivery. 88. A patient is experiencing chest pain that radiates to the left arm, accompanied by diaphoresis and nausea. What should be the nurse's immediate action? A. Administer nitroglycerin as prescribed. B. Encourage the patient to rest and drink water. C. Take the patient's vital signs every hour. D. Apply oxygen and prepare for transport to a cardiac care unit. Answer: D. Apply oxygen and prepare for transport to a cardiac care unit. Rationale: chest pain with radiating pain, diaphoresis, and nausea is characteristic of a myocardial infarction. Immediate action includes applying oxygen and preparing for transfer to a cardiac care unit for further evaluation and treatment. 89. What is the most appropriate position for a patient with acute myocardial infarction and severe chest pain? A. Supine with legs elevated. B. High Fowler's position. C. Prone with head turned to the side. D. Lying flat with arms extended. Answer: B. High Fowler's position. Rationale: high Fowler's position, sitting up at a 45-degree angle, helps reduce the workload on the heart and facilitates breathing. The other positions are not ideal for managing chest pain in this situation. 90. Which of the following is a non-modifiable risk factor for myocardial infarction? A. Hypertension. B. Physical inactivity. C. Family history of heart disease. D. Smoking. Answer: C. Family history of heart disease. Rationale: family history of heart disease is a non-modifiable risk factor. Hypertension, physical inactivity, and smoking are modifiable risk factors that can be controlled through lifestyle changes and medications. 91. After administering morphine for pain management in a patient with a myocardial infarction, the nurse notices the patient becomes hypotensive. What is the appropriate nursing action? A. Administer 4 fluids to increase blood pressure. B. Administer nitroglycerin to reduce heart workload. C. Monitor for further changes and adjust medications. D. Reassure the patient and monitor heart rate. Answer. A. Administer 4 fluids to increase blood pressure. Rationale. Morphine can cause hypotension, and 4 fluids are used to help restore blood pressure. Nitroglycerin could worsen hypotension, and monitoring is important, but fluid administration is the priority. 92. Which of the following is a goal of secondary prevention for a patient recovering from a myocardial infarction? A. Strict bed rest for 3 months. B. Aggressive management of hypertension and hyperlipidemia. C. Avoid all physical activity for 6 months. D. Limit fluid intake to prevent weight gain. Answer. B. Aggressive management of hypertension and hyperlipidemia. Rationale. Secondary prevention aims to reduce the risk of a second myocardial infarction by controlling modifiable risk factors such as hypertension and hyperlipidemia. Bed rest, avoiding physical activity, and limiting fluid intake are not appropriate prevention strategies. 93. A patient post-myocardial infarction is prescribed atorvastatin. What is the primary reason for this medication? A. To control heart rate. B. To reduce cholesterol levels. C. To treat high blood pressure. D. To relieve pain. Answer. B. To reduce cholesterol levels. Rationale. Atorvastatin is a statin medication used to lower cholesterol levels, reducing the risk of future cardiovascular events. It does not control heart rate, treat high blood pressure, or relieve pain. 94. What is the recommended time frame for administering fibrinolytic therapy in a patient with a myocardial infarction? A. Within 24 hours of symptom onset. B. Within 6 hours of symptom onset. C. Within 12 hours of symptom onset. D. Within 1 hour of symptom onset. Answer. C. Within 12 hours of symptom onset. Rationale. Fibrinolytic therapy is most effective when administered within 12 hours of symptom onset. The earlier it is given, the better the outcomes in restoring blood flow and limiting heart muscle damage. 95. A patient with a myocardial infarction is prescribed a beta blocker. What is the most important action of this medication? A. Decrease myocardial oxygen demand. B. Increase blood pressure. C. Relieve chest pain by dilating blood vessels. D. Prevent blood clots. Answer. A. Decrease myocardial oxygen demand. Rationale. Beta blockers work by reducing heart rate and blood pressure, thereby decreasing myocardial oxygen demand. They do not primarily relieve pain or prevent blood clots. 96. A patient with a history of myocardial infarction is being discharged. Which of the following is the most important aspect of discharge teaching? A. Rest as much as possible for the next 3 months. B. Follow up with cardiology and adhere to prescribed medications. C. Avoid all social activities to prevent stress. D. Drink plenty of fluids and eat a high-fat diet. Answer. B. Follow up with cardiology and adhere to prescribed medications. Rationale. Follow-up care and adherence to medications, including antiplatelets, ACE inhibitors, and statins, are essential for preventing future events. Excessive rest, avoidance of social activities, and an unhealthy diet are not recommended. 97. A patient with a myocardial infarction is experiencing anxiety. Which of the following is the best nursing intervention to reduce anxiety? A. Administer anti-anxiety medications. B. Encourage deep breathing and relaxation techniques. C. Increase physical activity to reduce stress. D. Restrict visitors to minimize stimulation. Answer. B. Encourage deep breathing and relaxation techniques. Rationale. Deep breathing and relaxation techniques help manage anxiety without the need for medication. Restricting visitors may not be necessary, and increased physical activity may be inappropriate during the acute phase. 98. Which of the following ECG findings would indicate a patient is experiencing a STEMI? A. ST segment elevation. B. Prolonged QT interval. C. T-wave inversion. D. Flattened P waves. Answer: A. ST segment elevation. Rationale: ST segment elevation is characteristic of a STEMI, ST elevation myocardial infarction, indicating acute myocardial injury. Other changes, such as prolonged QT or T-wave inversion, are not specific to STEMI. 99. A 55-year-old male with a myocardial infarction is experiencing a reduction in cardiac output. What is the most appropriate treatment? A. Increase fluids to increase blood volume. B. Administer vasopressors to increase blood pressure. C. Administer medications to reduce heart rate. D. Implement early mobilization to improve circulation. Answer: B. Administer vasopressors to increase blood pressure. Rationale: if a patient with MI is experiencing reduced cardiac output, vasopressors may be needed to stabilize blood pressure. Early mobilization and reducing heart rate are not appropriate in this situation. 100. What is the primary benefit of using a statin drug post-myocardial infarction? A. To reduce inflammation. B. To lower cholesterol and prevent further plaque buildup. C. To decrease blood pressure. D. To reduce blood clot formation. Answer: B. To lower cholesterol and prevent further plaque buildup. Rationale: statins help reduce cholesterol levels and prevent further plaque buildup in the arteries, reducing the risk of future heart attacks. They do not directly reduce inflammation, blood pressure, or blood clot formation. 101. A patient presents with chest pain and diaphoresis. The ECG shows ST segment elevation. What is the most likely diagnosis? A. Unstable angina. B. Stable angina. C. Non-ST segment elevation myocardial infarction STEMI. D. ST segment elevation myocardial infarction STEMI. Answer: D. ST segment elevation myocardial infarction STEMI. Rationale: ST segment elevation on ECG indicates a STEMI, which requires immediate treatment to restore blood flow and minimize heart damage. Unstable angina and STEMI are characterized by less severe ECG changes. 102. A 60-year-old patient presents with chest pain radiating to the left arm. Which of the following is the priority action? A. Administer aspirin. B. Start intravenous fluids. C. Administer nitroglycerin. D. Obtain an ECG. Answer: D. Obtain an ECG. Rationale: an ECG should be obtained immediately to assess the patient's heart function and determine if a myocardial infarction is occurring. Administering aspirin or nitroglycerin may be appropriate afterward, but the ECG is the priority for diagnosis. 103. A patient with myocardial infarction is prescribed aspirin. What is the purpose of this medication? A. To relieve pain. B. To reduce platelet aggregation and prevent clot formation. C. To control blood pressure. D. To reduce inflammation in the coronary arteries. Answer: B. To reduce platelet aggregation and prevent clot formation. Rationale: aspirin is an antiplatelet medication that reduces platelet aggregation, helping to prevent further clot formation and reduce the risk of a recurrent myocardial infarction. It does not primarily relieve pain, control blood pressure, or reduce inflammation. 104. Which of the following is the most appropriate intervention for a patient with a myocardial infarction and hypotension? A. Administer morphine for pain relief. B. Administer a vasopressor to increase blood pressure. C. Administer nitroglycerin to reduce preload. D. Place the patient in a Trendelenburg position. Answer: B. Administer a vasopressor to increase blood pressure. Rationale: vasopressors are used to stabilize blood pressure in patients with hypotension following a myocardial infarction. Morphine may reduce blood pressure further, and nitroglycerin could exacerbate hypotension. Trendelenburg position is not commonly used in this situation. 105. A patient with a myocardial infarction is receiving thrombolytic therapy. Which of the following is an important nursing consideration? A. Monitor for signs of bleeding. B. Monitor for increased blood pressure. C. Encourage the patient to ambulate frequently. D. Administer supplemental oxygen. Answer: A. Monitor for signs of bleeding. Rationale: thrombolytic therapy can increase the risk of bleeding, so careful monitoring for bleeding signs, e.g., hematuria, bruising, or melena, is essential. The other interventions are important, but not specific to thrombolytic therapy. 106. What is the primary purpose of administering beta blockers to a patient after a myocardial infarction? A. To decrease blood pressure. B. To decrease heart rate and myocardial oxygen demand. C. To prevent blood clots. D. To increase cardiac output. Answer: B. To decrease heart rate and myocardial oxygen demand. Rationale: beta blockers help to reduce heart rate and decrease myocardial oxygen demand, which is important for preventing further damage to the heart after a myocardial infarction. They do not directly prevent blood clots or increase cardiac output. 107. A 72-year-old patient with a myocardial infarction is receiving 4 heparin. What lab value is important to monitor? A. Prothrombin time, PT. B. Activated partial thromboplastin time, APTT. C. Hemoglobin level. D. Platelet count. Answer: B. Activated partial thromboplastin time, APTT. Rationale: heparin affects the clotting cascade, so monitoring the APTT is essential to ensure the patient is receiving the appropriate therapeutic dose. PT, hemoglobin, and platelet count are not as specific for monitoring heparin therapy. 108. A patient recovering from a myocardial infarction is prescribed an ACE inhibitor. What is the main benefit of this medication? A. To lower cholesterol. B. To reduce myocardial oxygen demand. C. To prevent heart failure. D. To increase heart rate. Answer: C. To prevent heart failure. Rationale: ACE inhibitors help reduce the risk of heart failure by lowering blood pressure and reducing the workload on the heart. They do not primarily lower cholesterol, reduce oxygen demand, or increase heart rate. 109. A patient is admitted to the hospital with acute chest pain. The doctor suspects myocardial infarction. Which diagnostic test is most useful in confirming this diagnosis? A. Arterial blood gas, ABG. B. Chest X-ray. C. ECG. D. CT scan. Answer: C. ECG. Rationale: an ECG is the primary diagnostic tool for identifying myocardial infarction, as it shows characteristic changes such as ST segment elevation or T-wave inversion. ABGs, chest X-rays, and CT scans may be used to rule out other conditions, but are not specific for MI. 110. Which of the following is a common complication of a myocardial infarction? A. Hypoglycemia. B. Pulmonary embolism. C. Ventricular arrhythmias. D. Renal failure. Answer: C. Ventricular arrhythmias. Rationale: ventricular arrhythmias are a common and life-threatening complication following a myocardial infarction due to disrupted electrical activity in the heart. Hypoglycemia, pulmonary embolism, and renal failure can occur but are less common in the acute phase of MI. 111. A nurse is caring for a patient who has had a myocardial infarction. Which assessment finding would indicate the need for immediate intervention? A. Blood pressure of 110/70 mmHg. B. Pulse rate of 96 beats per minute. C. Chest pain unrelieved by nitroglycerin. D. Oxygen saturation of 98%. Answer: C. Chest pain unrelieved by nitroglycerin. Rationale: chest pain unrelieved by nitroglycerin indicates continued ischemia or worsening myocardial damage, requiring immediate intervention. The other findings are within normal limits and do not suggest an emergency situation. 112. A patient who is at high risk for myocardial infarction asks the nurse about ways to reduce risk. Which of the following is the most effective method? A. Increase intake of saturated fats. B. Engage in regular physical activity. C. Avoid monitoring cholesterol levels. D. Increase sodium intake. Answer: B. Engage in regular physical activity. Rationale: Regular physical activity is one of the most effective ways to reduce the risk of myocardial infarction. Increasing saturated fats and sodium intake and avoiding cholesterol monitoring are unhealthy lifestyle choices. 113. Which of the following is the most common risk factor for myocardial infarction? A. Hypertension. B. Hyperlipidemia. C. Smoking. D. Obesity. Answer: C. Smoking. Rationale: smoking is a leading risk factor for myocardial infarction because it promotes atherosclerosis, increases blood clotting, and raises blood pressure. Hypertension, hyperlipidemia, and obesity are also risk factors, but smoking is most significant. 114. What is the first step in the management of a patient with a suspected myocardial infarction? A. Administer thrombolytics. B. Obtain a 12-lead ECG. C. Administer aspirin. D. Initiate 4 fluids. Answer: B. Obtain a 12-lead ECG. Rationale: the first step in the management of suspected myocardial infarction is to obtain a 12-lead ECG to confirm the diagnosis and guide further treatment. Aspirin and 4 fluids may be administered afterward, but the ECG is the priority. 115. A patient with myocardial infarction is started on anticoagulation therapy. What is the primary reason for this treatment? A. To reduce myocardial oxygen demand. B. To prevent further clot formation. C. To decrease cholesterol levels. D. To control blood pressure. Answer: B. To prevent further clot formation. Rationale: anticoagulation therapy is used to prevent further clot formation, which could obstruct coronary arteries and cause additional damage to the heart. It does not directly affect myocardial oxygen demand, cholesterol, or blood pressure. 116. A patient with myocardial infarction is being prepared for angioplasty. What is the primary goal of this procedure? A. To increase the heart's oxygen supply. B. To restore blood flow by opening the blocked artery. C. To decrease blood pressure. D. To remove plaque from the coronary arteries. Answer: B. To restore blood flow by opening the blocked artery. Rationale: angioplasty aims to open blocked or narrowed coronary arteries, restoring blood flow to the heart muscle. It does not directly decrease blood pressure or remove plaque, although plaque rupture may be a part of the procedure. 117. A patient is admitted with a STEMI and is receiving fibrinolytic therapy. What is the primary goal of this treatment? A. To reduce pain and anxiety. B. To dissolve the clot obstructing the coronary artery. C. To reduce myocardial oxygen demand. D. To prevent arrhythmias. Answer: B. To dissolve the clot obstructing the coronary artery. Rationale: fibrinolytic therapy is used to dissolve the clot blocking the coronary artery, restoring blood flow to the heart muscle. It does not primarily reduce pain, oxygen demand, or prevent arrhythmias, although it may help prevent further complications. 118. Which of the following is a contraindication for fibrinolytic therapy in a patient with myocardial infarction? A. Age over 75 years. B. History of gastrointestinal bleeding. C. Hypertension. D. Diabetes. Answer: B. History of gastrointestinal bleeding. Rationale: a history of gastrointestinal bleeding is a contraindication for fibrinolytic therapy due to the increased risk of bleeding. Age over 75, hypertension, and diabetes are not absolute contraindications, although they may require careful consideration. 119. A patient is prescribed a statin after myocardial infarction. Which side effect should the nurse monitor for? A. Hyperkalemia. B. Liver toxicity. C. Hypotension. D. Bradycardia. Answer: B. Liver toxicity. Rationale: statins can cause liver toxicity, so liver function should be monitored. Hyperkalemia, hypotension, and bradycardia are not common side effects of statins. 120. A nurse is preparing a patient for discharge after a myocardial infarction. Which of the following lifestyle changes is most important to discuss? A. Decrease alcohol consumption. B. Increase sodium intake. C. Begin an exercise program as tolerated. D. Restrict fluid intake. Answer: C. Begin an exercise program as tolerated. Rationale: beginning a gradual exercise program as tolerated is important for improving cardiovascular health and reducing the risk of future heart problems. Decreasing alcohol consumption, increasing sodium intake, and restricting fluid intake are not primary interventions. 121. A patient is receiving fibrinolytic therapy for STEMI. Which of the following is a priority nursing action? A. Monitor for signs of bleeding. B. Administer oxygen via nasal cannula. C. Monitor for signs of hyperkalemia. D. Provide reassurance and emotional support. Answer: A. Monitor for signs of bleeding. Rationale: fibrinolytic therapy increases the risk of bleeding, so monitoring for signs such as hematuria, bruising, and gastrointestinal bleeding is critical. Oxygen and emotional support are important, but secondary in this scenario. 122. Which of the following is a common early sign of myocardial infarction? A. Nausea and vomiting. B. Lower back pain. C. Abdominal bloating. D. A headache. Answer: A. Nausea and vomiting. Rationale: nausea and vomiting are common early signs of a myocardial infarction, especially in women. Lower back pain, abdominal bloating, and a headache are not typical early symptoms of MI. 123. A patient with a myocardial infarction is prescribed aspirin and clopidogrel. What is the rationale for this combination therapy? A. To lower cholesterol levels. B. To prevent further platelet aggregation and clot formation. C. To increase heart rate. D. To prevent arrhythmias. Answer: B. To prevent further platelet aggregation and clot formation. Rationale: both aspirin and clopidogrel are antiplatelet drugs that work together to reduce platelet aggregation, decreasing the risk of further clot formation and improving blood flow to the heart. 124. A patient with myocardial infarction is receiving morphine. What is the primary benefit of this medication? A. To reduce pain and anxiety. B. To lower blood pressure. C. To increase cardiac output. D. To reduce inflammation in the coronary arteries. Answer: A. To reduce pain and anxiety. Rationale: morphine is used primarily for pain and anxiety relief in patients with myocardial infarction. It may also have mild effects on reducing myocardial oxygen demand, but its main benefit is pain control. 125. A patient is experiencing chest pain and shortness of breath. Which of the following diagnostic tests is most useful in diagnosing a myocardial infarction? A. Chest X-ray. B. Serum troponin levels. C. Arterial blood gases. D. Complete blood count. Answer: B. Serum troponin levels. Rationale: elevated troponin levels are the most specific biomarkers for myocardial injury, confirming the diagnosis of myocardial infarction. Chest X-ray, ABGs, and CBC are useful for ruling out other conditions, but are not specific for MI. 126. What is the primary goal of percutaneous coronary intervention, PCI, in the management of STEMI? A. To relieve pain. B. To reduce heart rate. C. To open the blocked coronary artery. D. To reduce blood pressure. Answer: C. To open the blocked coronary artery. Rationale: PCI is performed to open blocked coronary arteries and restore blood flow to the heart muscle, which is the primary goal in treating STEMI. Pain relief, heart rate control, and blood pressure management are secondary goals. 127. Which of the following medications is commonly prescribed to reduce the risk of clot formation in patients following myocardial infarction? A. Digoxin. B. Warfarin. C. Aspirin. D. Calcium channel blockers. Answer: C. Aspirin. Rationale: aspirin is an antiplatelet medication commonly used after myocardial infarction to reduce the risk of clot formation. Digoxin and calcium channel blockers are used for other cardiac conditions, and warfarin is not typically prescribed after MI unless there is an additional indication. 128. Which of the following is a common complication of a myocardial infarction? A. Stroke. B. Asthma. C. Pneumonia. D. Renal failure. Answer: A. Stroke. Rationale: a stroke is a common complication of myocardial infarction, especially if blood clots travel from the heart to the brain. Pneumonia, asthma, and renal failure are not as directly related to MI. 129. A patient with a myocardial infarction is prescribed a statin. What is the purpose of this medication? A. To lower cholesterol and stabilize plaques. B. To relieve chest pain. C. To reduce heart rate. D. To increase myocardial oxygen supply. Answer: A. To lower cholesterol and stabilize plaques. Rationale: statins help lower cholesterol and stabilize plaques in the coronary arteries, reducing the risk of future heart attacks. They do not directly relieve pain, reduce heart rate, or increase oxygen supply. 130. A patient with a history of myocardial infarction asks the nurse about lifestyle changes to reduce the risk of another heart attack. Which of the following should the nurse emphasize? A. Increase sodium intake to improve circulation. B. Limit physical activity to prevent strain on the heart. C. Engage in regular physical activity and eat a heart-healthy diet. D. Avoid monitoring blood pressure. Answer: C. Engage in regular physical activity and eat a heart-healthy diet. Rationale: regular physical activity and a heart-healthy diet, low in saturated fats, high in fruits and vegetables, are key lifestyle changes to reduce the risk of future myocardial infarctions. Increasing sodium intake and limiting physical activity are not beneficial. 131. A 58-year-old male is diagnosed with myocardial infarction. His troponin levels are elevated. Which of the following is the most accurate interpretation of this lab result? A. The patient has a heart attack. B. The patient has congestive heart failure. C. The patient has unstable angina. D. The patient has kidney failure. Answer: A. The patient has a heart attack. Rationale: elevated troponin levels are specific markers for myocardial injury, confirming a heart attack. Unstable angina and congestive heart failure can present with similar symptoms, but do not cause elevated troponin levels. 132. A patient is being discharged after a myocardial infarction. Which of the following should the nurse prioritize when teaching the patient about lifestyle modifications? A. Avoid all forms of exercise for at least 6 months. B. Stop all medications once symptoms improve. C. Quit smoking and adhere to a low-fat, low-sodium diet. D. Avoid all stressors, including work and social activities. Answer: C. Quit smoking and adhere to a low-fat, low-sodium diet. Rationale: quitting smoking and adhering to a heart-healthy diet are key to reducing the risk of further heart problems. Avoiding exercise and stopping medications are not recommended. Moderate exercise and medication adherence are essential. 133. A nurse is preparing to administer a thrombolytic agent to a patient with STEMI. Which of the following is a major contraindication for thrombolytic therapy? A. Recent gastrointestinal bleeding. B. Age under 65. C. Mild hypertension. D. History of asthma. Answer: A. Recent gastrointestinal bleeding. Rationale: recent gastrointestinal bleeding is a major contraindication for thrombolytic therapy because of the high risk of severe bleeding. Age under 65, mild hypertension, and a history of asthma are not absolute contraindications. 134. A patient is receiving thrombolytic therapy for myocardial infarction. Which of the following is the most important observation during the first 24 hours? A. Monitor for signs of bleeding. B. Monitor for bradycardia. C. Monitor for respiratory distress. D. Monitor for hyperkalemia. Answer: A. Monitor for signs of bleeding. Rationale: bleeding is a major risk with thrombolytic therapy, and the nurse should closely monitor for signs such as bruising, hematuria, or gastrointestinal bleeding. The other options are not as directly related to thrombolytic therapy. 135. A patient with a myocardial infarction is prescribed an ACE inhibitor. What is the primary benefit of this medication? A. To decrease blood pressure and prevent heart failure. B. To prevent blood clot formation. C. To relieve chest pain. D. To stabilize the arterial plaque. Answer: A. To decrease blood pressure and prevent heart failure. Rationale: ACE inhibitors are commonly prescribed after a myocardial infarction to lower blood pressure, reduce the workload on the heart, and prevent heart failure. They do not directly prevent blood clot formation or relieve pain. 136. A patient has just been diagnosed with a myocardial infarction. Which of the following is the most important initial intervention? A. Administer aspirin and nitroglycerin. B. Start 4 fluids. C. Prepare for surgery. D. Provide emotional support. Answer: A. Administer aspirin and nitroglycerin. Rationale: aspirin helps to prevent further clot formation. 137. A patient with myocardial infarction is prescribed a beta blocker. What is the primary purpose of this medication? A. To increase heart rate. B. To reduce myocardial oxygen demand. C. To prevent arrhythmias. D. To reduce blood pressure. Answer: B. To reduce myocardial oxygen demand. Rationale: beta blockers reduce myocardial oxygen demand by slowing the heart rate and reducing contractility, which helps prevent further heart damage after a myocardial infarction. They also have a role in reducing blood pressure and preventing arrhythmias. 138. A patient presents with crushing chest pain radiating to the left arm. Which of the following is the most likely cause of this pain? A. Gastroesophageal reflux disease (GERD). B. Myocardial infarction. C. Pulmonary embolism. D. Gallbladder disease. Answer: B. Myocardial infarction. Rationale: crushing chest pain radiating to the left arm is a classic symptom of myocardial infarction. GERD, pulmonary embolism, and gallbladder disease can cause chest pain, but usually with different characteristics. 139. Which of the following biomarkers is most commonly used to confirm the diagnosis of myocardial infarction? A. D-dimer. B. Brain natriuretic peptide (BNP). C. Troponin. D. Creatine kinase (CK). Answer: C. Troponin. Rationale: troponin is the most specific and sensitive biomarker for myocardial injury, making it the gold standard for diagnosing myocardial infarction. D-dimer is used to assess clotting disorders, BNP measures heart failure, and CK is less specific for myocardial infarction. 140. A patient is undergoing coronary angiography after a myocardial infarction. What is the primary purpose of this procedure? A. To assess the electrical activity of the heart. B. To measure ejection fraction. C. To visualize the coronary arteries and identify blockages. D. To obtain tissue samples from the heart muscle. Answer: C. To visualize the coronary arteries and identify blockages. Rationale: coronary angiography is performed to visualize the coronary arteries and identify any blockages or narrowing that may require intervention, such as angioplasty or stenting. It does not assess electrical activity, measure ejection fraction, or obtain tissue samples. 141. A patient is prescribed nitroglycerin for chest pain associated with myocardial infarction. What is the primary effect of nitroglycerin? A. To increase blood pressure. B. To decrease heart rate. C. To dilate coronary arteries and improve blood flow. D. To increase oxygen demand. Answer: C. To dilate coronary arteries and improve blood flow. Rationale: nitroglycerin is a vasodilator that primarily dilates coronary arteries, improving blood flow to the heart muscle and relieving chest pain. It does not increase blood pressure or oxygen demand, and it may have a minor effect on heart rate. 142. Which of the following is an early indicator of heart failure following a myocardial infarction? A. Increased troponin levels. B. Decreased oxygen saturation. C. Elevated brain natriuretic peptide, BNP. D. Decreased white blood cell count. Answer: C. Elevated brain natriuretic peptide, BNP. Rationale: BNP is elevated in heart failure due to increased stretch of the ventricles. It is a useful biomarker for detecting heart failure following a myocardial infarction. Troponin levels indicate myocardial injury, not heart failure, while decreased oxygen saturation and white blood cell count are not specific early indicators of heart failure. 143. A patient with myocardial infarction is at risk for arrhythmias. Which of the following arrhythmias is most commonly associated with acute myocardial infarction? A. Atrial fibrillation. B. Sinus tachycardia. C. Ventricular fibrillation. D. First-degree heart block. Answer: C. Ventricular fibrillation. Rationale: ventricular fibrillation is the most life-threatening arrhythmia associated with acute myocardial infarction and requires immediate intervention, such as defibrillation. Atrial fibrillation, sinus tachycardia, and first-degree heart block are also possible but are less immediately dangerous. 144. A 70-year-old patient is recovering from a myocardial infarction. Which of the following interventions should the nurse prioritize during the rehabilitation phase? A. Strict bed rest for several weeks. B. Gradual increase in physical activity as tolerated. C. Immediate return to normal work activities. D. Limiting all physical activity. Answer: B. Gradual increase in physical activity as tolerated. Rationale: gradual resumption of physical activity, as tolerated, is important for improving cardiovascular health and reducing the risk of future complications. Strict bed rest, limiting activity, and returning to normal activities too quickly can delay recovery. 145. A patient with a history of myocardial infarction presents with persistent shortness of breath and edema. What is the most likely cause of these symptoms? A. Pulmonary embolism. B. Heart failure. C. Pneumonia. D. Chronic obstructive pulmonary disease, COPD. Answer: B. Heart failure. Rationale: persistent shortness of breath and edema are common symptoms of heart failure, a complication that can arise after a myocardial infarction. Pulmonary embolism, pneumonia, and COPD can cause similar symptoms but are less likely in the setting of recent MI. 146. Which of the following is a modifiable risk factor for myocardial infarction? A. Family history of heart disease. B. Age over 65 years. C. High cholesterol levels. D. Gender. Answer: C. High cholesterol levels. Rationale: high cholesterol is a modifiable risk factor for myocardial infarction and can be managed with lifestyle changes and medication. Family history, age, and gender are non-modifiable risk factors. 147. A patient is being treated with a thrombolytic agent for a myocardial infarction. Which of the following is a common complication of this treatment? A. Hypoglycemia. B. Pulmonary edema. C. Bleeding. D. Hyperkalemia. Answer: C. Bleeding. Rationale: a common complication of thrombolytic therapy is bleeding, as the medication dissolves clots and can also affect other parts of the body. Hypoglycemia, pulmonary edema, and hyperkalemia are not typical complications of thrombolytic therapy. 148. A nurse is caring for a patient with a myocardial infarction who is receiving intravenous heparin. Which laboratory test should the nurse monitor to assess the effectiveness of the heparin? A. Prothrombin time, PT. B. Activated partial thromboplastin time, APTT. C. Hemoglobin level. D. Serum troponin. Answer: B. Activated partial thromboplastin time, APTT. Rationale: heparin therapy is monitored by checking the APTT to ensure that the patient is receiving the appropriate therapeutic dose. PT, hemoglobin level, and serum troponin are not directly related to monitoring heparin therapy. 149. A patient who experienced a myocardial infarction asks the nurse how to prevent another heart attack. Which of the following is the most important lifestyle modification to recommend? A. Increase intake of red meat. B. Quit smoking and maintain a healthy weight. C. Engage in high-intensity exercise daily. D. Reduce fluid intake. Answer: B. Quit smoking and maintain a healthy weight. Rationale: quitting smoking and maintaining a healthy weight are two of the most effective lifestyle modifications to prevent another myocardial infarction. Reducing red meat intake, engaging in high-intensity exercise, and reducing fluid intake are not as critical as addressing smoking and weight. 150. A patient with myocardial infarction is prescribed enoxaparin, a low molecular weight heparin. What is the primary purpose of this medication? A. To dissolve blood clots. B. To prevent the formation of new blood clots. C. To lower cholesterol levels. D. To reduce inflammation in the coronary arteries. Answer: B. To prevent the formation of new blood clots. Rationale: enoxaparin is an anticoagulant that prevents the formation of new blood clots, reducing the risk of further complications after a myocardial infarction. It does not dissolve existing clots, as thrombolytic agents do, lower cholesterol, or directly reduce inflammation.